Oart will be on duty there in New Rochelle to help enforce the 1 mile radius under the order. Whit Johnson is there with the latest. Good morning, Whit.
Michael, good morning. Officials say about 100 to 200 members of the National Guard will arrive here in New Rochelle tomorrow to help sanitize and clean schools, public areas, and even deliver food if needed. Governor Cuomo calling this deployment a dramatic effort to attack this outbreak at the source. This morning, New York ordering the nation's first containment zone as the number of those infected continues to climb. The governor deploying the National Guard to New Rochelle, a suburban coronavirus hotspot north of Manhattan.
It is a dramatic action. This is literally a matter of life and death.
That zone consisting of a 1 mile radius around the Young Israel Synagogue, where dozens of people were exposed by that infected attorney. Schools and buildings that hold large gatherings will shut down for 2 weeks, but most businesses and grocery stores will remain open, and people will be able to enter and leave the area.
You're not containing people, it's facilities.
According to some residents, many are staying home.
It's empty. I was there, and I'm there usually every weekend running errands. Stores were empty, and there's no one around.
Among the new cases statewide, 2 school bus drivers testing positive. Across the country, the death toll rising to at least 30, and at least 18 states declaring a state of emergency. Washington State reporting at least 10 nursing homes with confirmed cases. Infections in Massachusetts more than doubling, with at least 70 of the cases connected to a Biogen employee conference held in Boston last month. And in Minnesota, a 30-year-old patient now in critical condition after experiencing flu symptoms and visiting a health facility last week, but was sent home without testing.
You have to start taking seriously what you can do now, that if and when the infections will come, and they will come.
Concerns of the spreading virus prompting a wave of cancellations, including the New York City Half Marathon and the Ivy League basketball tournaments. Popular music festival Coachella postponed until October to avoid crowd contamination. Major companies like Apple and Google encouraging their employees to work from home. And universities like UCLA, Duke, and Ohio State University are canceling in-person classes. Harvard University forcing students to move out of the dorms and take online classes instead.
Many of us are international students from countries where the coronavirus has basically halted all travel.
And the New York Times launching a deep cleaning of their newsroom in New York and D.C., notifying employees to stay home for 14 days after some New York Times staffers attended a conference in New Orleans, where an attendee not with the paper tested positive for coronavirus. Despite assurances from the federal government, many local officials are still frustrated with the backlog and the red tape when it comes to testing. In fact, we spoke with one doctor in Massachusetts who says he has multiple patients showing possible symptoms and he still can't get them tested. Robin?
All right, Whit, thank you. As we know, the world is fighting to contain the outbreak. We're going to take a live look at the cases around the globe. This according to the Johns Hopkins tracker. Almost 1,000 and 20,000 worldwide. One of the areas hit the hardest is Italy, with the most cases of any country outside of China, now topping 10,000 with 631 deaths. James Longman has more on the conditions under lockdown in Italy after returning from there himself. Good morning, James.
Hi, Robin. Yeah, good morning. I'm going to self-isolate now for a while. It's just the most sensible thing to do after having returned from Italy, which is facing, as you say, the biggest crisis anywhere in the world outside of China. More than 10,000 cases now in that country. More than 600 people have died. The hospitals are just overwhelmed. We're seeing images of tents being built outside them in order to treat the ill. ICUs are overflowing. This is an assault on the elderly population of Italy. They are the overwhelming victims here. And so this lockdown that we're seeing in that country is really unprecedented. The police are enforcing it. Schools are shut. 60 million people, more than 60 million people live in Italy. Just think about that. Landmarks across the country. This is a huge tourist destination, and they are all deserted today. And here in the UK, we're seeing the fallout continue with a health minister now testing positive for the virus. And it's emerged that she actually met with the Prime Minister the day before she was tested. There's a lot to worry about here in Europe, Michael.
A lot to worry about indeed, James. Thank you so much for that. And now to the big question over testing for the virus here in the U.S. President Trump has said anyone who wants to get tested can, but an ABC News analysis shows just over 6,800 tests have been administered in the U.S. as opposed to 200,000 in much smaller South Korea. Steve Ozensami is outside CDC headquarters in Atlanta with more on where the tests are. Good morning, Steve.
Good morning to you, Michael. Here at the CDC, they tell us that the first tests that were available went to the states of Washington and California, where they were needed most. Since then, these tests can't be made fast enough. As fear and panic over the coronavirus sweep the country, the president is reassuring Americans that there are enough coronavirus tests to go around.
When people need a test, they can get a test. When the professionals need a test, when they need tests for people, they can get the test.
Vice President Pence is saying the same, announcing that millions are being shipped.
We want people to get tested. Over 1 million tests are out, thanks to the diligent work of CDC and HHS. More than 4 million will go out this week.
But this morning, some doctors are saying that despite government assurances, they can't get the tests they need.
When you know that there's community transmission, that means there's a lot more undiagnosed cases than diagnosed cases. So we really have to up our level of testing.
The test is a simple nose swab that's processed in a lab like this one in New York State. But which patients actually get one of these tests is more complicated. The decision is usually made by state governments using CDC recommendations that the only people who should get a coronavirus test are people who have symptoms, have come into close contact with someone who has the virus, or have traveled to an affected area like China, Italy, or South Korea. So far, nearly 7,000 people have been tested here in America. In contrast, South Korea has already tested more than 200,000 people. As tests become more available, some states like Washington and Colorado are setting up drive-through testing locations, hoping that a test in a drive-through will limit the risk of contamination and prevent the spread of germs in a hospital. Two of the most famous residents in Washington state are trying to help. Bill and Melinda Gates are reportedly working on a coronavirus test that can be used at home. George?
Thank you, Steve. We're joined now by the Secretary of Health and Human Services, Alex Azar. Secretary Azar, thank you for joining us this morning. As we just heard, there are still so many issues surrounding testing here in the United States. We're still hearing from doctors they can't get the tests they need. So just lay out the bottom lines right now. How many Americans have been tested? How many will be tested? And what is that likely to mean for the number of cases here in the United States?
So, George, the key thing your viewers need to know is that we have and always have had the capacity to test anybody who's suspected of novel coronavirus. Right now, we have millions of tests available. Anybody who's a person under investigation, suspected by medical professionals or by public health officials, is going to get tested, will get tested, and will get that data if they're a positive case.
Let's talk about these containment measures we're seeing. New Rochelle being contained right now. Washington State expected to announce today really a ban on any kind of large gatherings. And Dr. Fauci was pretty sober yesterday afternoon. How much more of this are we going to need? More of these containment measures are we going to need to prevent a big spike in cases?
Yeah, George, we're going to see very aggressive efforts to